Joining us for the COVID-19 media call for January 11th. We'll start today with comments from Health Commissioner Jan Malcolm, Infectious Disease Director Chris Erzman, and Sarah Vetter. Sarah is an Assistant Director with our Public Health Lab. After their opening comments, we'll open it up for questions from reporters on the line. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. Globally, we are now above 90.3 million cases and over 1.93 million deaths worldwide. In the United States, we're now more than 22.4 million cases and over 374,000 deaths in our country. Here in Minnesota, over the weekend, we reported more than 4,600 new COVID cases. That was 2,483 announced on Saturday and 2,165 announced on Sunday. Today, our state report shows an additional 980 cases on a testing volume of 15,980 tests. A new total of 437,552 cumulative cases since the start of the pandemic. With regard to today's numbers, though, Chris Erzman will provide a brief update on a reporting issue we wanted to mention regarding today's cases, and it just kind of illustrates once again why we often say any one day's data in and of itself has got some anomalies to it. So why we really focus as much as we do on week over week kinds of analyses. In addition to the new cases reported over the weekend, we announced another 87 COVID deaths during that same time period, 43 deaths reported Saturday, 44 on Sunday. We announced 4 COVID deaths in today's report that was reported in to us on the day prior, bringing us to a new total of 5,711 deaths since the start of the pandemic. This is a low number of deaths reported yesterday, which we're always grateful to see, but that often is an artifact of weekend reporting from the mortuaries. And we have also seen a couple of lower days at other times last month, which unfortunately did not sustain as a trend. So much as we are grateful for a lower number today, we are not anticipating that signals a new trend necessarily. There are 686 people currently in Minnesota hospitals being treated for COVID-19 specifically. Of those, 141 are in intensive care. That continues, though we did see an increase yesterday in the number of beds occupied by COVID patients. We still have only half the beds in use for COVID care that we did earlier in December. The 7-day rolling average number of Minnesotans admitted to the hospital continues to be fairly stable. We've had a cumulative total of 22,815 patients hospitalized since the beginning of the pandemic, with 4,783 of those requiring intensive care. On the vaccine administration front, most current posted data, January 8th, so last Friday, 147,645 doses have been administered to Minnesotans. And this is out of a total of just under 400,000 total doses of vaccine allocated to our state by the federal government, although as we have discussed in prior calls, it does not mean all of the doses are in the state or available to vaccinators. So I think I'll just leave it there in terms of today's situation report, other than to note that the change in the trends that we've been reporting on, continues to be pretty much the same picture, with some uptick in cases and in test positivity that we are watching during the lag period. With that, I'm going to turn it to Chris Erzman to talk about the data clarification issue that I mentioned.
Thank you, Commissioner. I just wanted to let you know that we had a delay in loading a file from Vault Laboratory that resulted in tests reported on January 10th 2021 or yesterday, not making it into the test counts for the website today. So again, I want to be explicit, we're talking about information about tests. The file that was delayed in loading, or that we were delayed in loading, contained 9,193 results with 558 positives. Now, I want to acknowledge that the 558 positive tests represent both new COVID cases and repeat tests on COVID cases. So the number of new cases represented by that file will ultimately be less than 558. Usually, it takes 24 to 48 hours after initial report for a case to get added to the website. So having missed this data does not really impact our case count. They'll be reported and included in our data on January 12th, tomorrow. However, it did, as I mentioned, impact our test count because we don't create a new file for a test. We don't, do follow-up. We just count the tests. And so having the delay means that the tests that we reported today were short by 9,193 tests. These tests will be reported on the web tomorrow. And with that, I will turn it over to Sarah Vedder to talk about the UK variant.
Sarah, you're on mute if you're talking.
Oh, thank you very much. Good afternoon, everybody. On Saturday, the Minnesota Department of Health announced the UK variant strain, otherwise known as the B117 strain of the SARS-CoV-2 virus, which was first detected in the United Kingdom. It was identified in positive specimens from 5 residents from 4 different counties in the Twin Cities metro area. 4 of these cases were identified through the MDH Public Health Laboratory, and 1 was identified through the Centers for Disease Control and Prevention. The CDC has a collaboration with National Reference Laboratories where they're partnering and sequencing 1,500 samples a week. And so that is where that 5th case came from. The cases range from ages 15 to 37, and their illness onsets range from December 16th to December 31st. None were hospitalized to our knowledge. 2 of the cases reported international travel, 1 did not travel, and others have unknown travel history. MDH epidemiologists are re-interviewing the cases to gather more information about how they were likely exposed and who their close contacts were. That investigation is continuing. It's important to note that this variant strain of the virus has been found in other states in the US, so we expected that at some point we would find the virus in Minnesota. Knowing that it is now here, it does not change our public health recommendations. While it is thought to be more easily spread from one person to another, it has not been found to cause more serious disease. With RNA viruses like SARS-CoV-2, the virus that causes COVID-19, it is not unexpected to see new or more successful strains emerge. The fact that the variant strain is thought to be more contagious, but not more virulent than the strains currently in circulation in Minnesota reinforces the importance of wearing a mask, social distancing outside your home, and quarantining if you've been exposed to a positive case. The good news is that preliminary studies indicate that COVID-19 vaccine currently in use are effective against this variant strain. Whether this new strain infects more people will be determined to a large degree by how rigorously we all practice those protective measures that are so important. Getting as many people vaccinated as possible will also be critical in the control of spread of this variant and the emergence of other variants. This variant strain of the virus was first detected in the United Kingdom in September 2020 and has been found in numerous countries around the world, including the United States. According to the CDC, 63 cases of this variant strain have been identified in 8 states as of January 8th. With that, Mike, I'll turn it over to you.
Thanks, Sarah. Operator, we're ready to take questions.
At this time, I would like to remind everyone, in order to ask a question, press star, then the number 1 on your telephone keypad. We'll pause for just a moment to compile the Q&A roster. Your first question comes from the line of Jeremy Olson from Star Tribune.
Hi all. A couple vaccine-related questions, but the latest CDC COVID vaccine tracker data puts Minnesota about 23rd in the U.S. for our COVID vaccination rate. We've kind of varied up and down from there over the last few days. And so, I mean, our average is by definition okay, but we were part of the initial process of planning all this out. And I wonder if we would have expected above average performance rather than average. So I wanted to ask if you're satisfied with Minnesota's performance relative to other states so far, and also if there have been any other success stories from other states that are reacting to this as you are, and whether you've been able to apply any of those.
Terry, this is Jan. I'll start and then invite Chris to comment as well. I think as the governor mentioned on one of our calls last week, there's just a fair amount of noise in these data, which is, I don't offer that as an excuse, but just a reality observation that, again, with the way that CDC is reporting the doses that have been allocated to the states, and then it takes up to more than a week for the allocated doses to actually arrive in Minnesota. And that can vary from state to state. Some states might get more of their weekly shipment earlier in the state and have earlier in the week and have more days of the week to vaccinate. So there's some of that just can be, another important layer of information is how many doses are actually in the state, and then how many doses are actually out to the site where the vaccination is going to happen, and how quickly does it happen from that point. Are we satisfied? No. We would like to speed up every step of that process that we can. Some of it just isn't under our control, like the manufacturer's shipping schedules, but we are working hard with our vaccination partners to make sure that any parts of the process that are under our control, that we are getting more and more efficient at that. We do expect these numbers to go up, steadily from here. I think Chris made the point last week that it was really only, I think, Friday of last week that we even started to get data from a regular week, if you will, that didn't have a major holiday and blizzard in it. So we think that the data we'll be getting in the coming days will be more indicative of what the true performance is. But absolutely, we are a competitive bunch and hope and intend to improve in those state-by-state comparisons, even though they're not always apples to apples. Chris, anything to add?
Yeah, I would second that, and I think we're looking at the data. We're reaching out to our partners in healthcare to get information from them about how they're conducting their vaccination. I know that when we look at the data, we see that the majority of vaccines are administered on a Monday through Friday schedule, and certainly, we'll be challenging partners to use every day of the week to provide vaccine, that type of thing. So we're definitely looking at ways that we can improve efficiencies, although I do think that as we consider the process, there are also, elements of learning. And I think that whenever you have a situation where you're asking people to prioritize and look at definitions, that can sometimes be challenging and take time with vaccinating as opposed to just anybody that walks by. So I think that also contributes.
A brief follow-up question. I imagine you have some ability to influence your providers, your hospitals and clinics out there. Is there anything you can do to kickstart progress with the long-term care vaccinations under the federal program? Or are you kind of at the mercy of the pharmacy partners and the federal program? Because they seem to have been kind of slow and are probably hampering your numbers a bit.
Chris, can you speak to that?
Yes, Jeremy, that's a really good point. We have 124,000 doses that are allocated to the federal pharmacy partnership for long-term care program. And we are relying on national pharmacy chains to do that vaccinating. And they do have a huge portion of our long-term care facilities and assisted livings to work with. And so you're right, that does make a difference. The program is really handled, at the federal level. We have done some things to make, or to assist these partners, for instance, to allow them to bring in pharmacists and pharmacy techs from out of state to help facilitate. And we'll be continuing to monitor their progress to see if there's anything else we can do. But they do have a separate contract with the federal government for that role that they've taken on.
Thank you.
Our next question comes from the line of Catherine Richards from Minnesota Public Radio.
Hi there. I want to jump off of Jeremy's question really quickly. First of all, I heard earlier today from Mayo that some of their vaccines have actually been reallocated to the assisted living vaccination program. Can you speak to that a little bit? Is there simply not enough right now, or why is that being done? And are all hospitals sort of having to give up some of their vaccines to go to that part of the program?
Well, a couple things. One is that it's very important that we're vaccinating individuals who fall into the priority group. So, tier 1 would be the, COVID direct patient care, emergency rooms, intensive care, skilled nursing. Tier 2 is all acute care, and then assisted living. And so if we have healthcare systems that may have been moving beyond that, then yes, we need to make sure that we're continuing to prioritize in as much as possible the doses for our highest priority groups, which are our residents in skilled nursing and assisted living.
Okay, and I'm just wondering, have you had to do that reallocation? Is that pretty widespread around the state? I'm sorry if that question.
Oh, yes, we're continuing to look at where all of our partners are at in the vaccination process and make sure that we have adequate supplies to both balance the need to vaccinate healthcare workers in tier 1 and 2, as I said, in acute care settings, and then make sure that we have sufficient doses to vaccinate residents in our skilled nursing and assisted living.
Okay. I know with elementary schools opening as early as next week, what do we know, if anything, about how susceptible children are to this new variant? And does that reframe any decisions around reopening schools now that we know the variant is in the state?
Jen, would you like to take it?
Oh, yeah, if you could take this.
Okay. We don't have information about this particular variant in kids unless Sarah has some specific information that I'm not aware of. I can tell you that there were a couple of new studies or new articles that came out this week, both from Sweden, from Norway, and from North Carolina, looking at their experience in schools and finding that transmission in those settings could be mitigated. So that was positive news. But I'll let Sarah comment if she's heard anything about children in particular.
Nope, I have not heard anything on the UK variant or the South African variant, any of the variants out there and their effects on children.
Operator, I think we're ready for the next question.
Your next question comes from the line of Heidi Windal from Care 11.
You guys hear me? Oh, sorry. I was just going to ask, in Minnesota, we saw the cases are 15 to 37 years old, and we've seen reports that this variant affects younger people more. Do you know why that is?
Sarah, can you take that one first?
Yeah, I don't think we know why that is. I will say, in general, we see this virus, affecting that age group more. And so this variant seems to kind of follow that pattern, but I think it's just too early to tell if there's something special about this virus, or if it's just like it's this parent strain.
All right, and then my other question was going to be about the COVID Aware, the latest news. I was curious if you had numbers since launching in November of if you've seen it be an effective tool and how many people have been able to put in their data or have been notified about a potential exposure.
Heidi, I know that. Oh, go ahead.
Yeah, Chris, go ahead, please. I was going to ask you to take it. Thanks.
Okay, Heidi, I was just going to say that we are using it on a regular basis with our case and contact follow-up. I don't have the exact numbers, so I will check with the team and we can let you know that.
Overall, do you think it has been oh, sorry, go ahead.
Sorry. Yeah, Chris, you'll want to confirm the exact numbers, but I think the last number I heard was that over 4,000 people had released their codes through the app. So that's pretty significant.
Yeah. And what were you saying, Heidi? What was your question?
Oh, I was just going to say, overall, have you found it's been an effective tool as one of the tools you have?
Oh, yes. No, it's been a very effective tool. And particularly as case numbers have been up, as well as it's a means for people who may be feeling a little bit uncomfortable about providing information, they can still assist with the public health response and mitigation by using the app. And so that's positive.
Thank you.
Your next question comes from the line of Tom Lydon from Fox 9. Sir, your line is open. Once again, this is from the line of Tom Lydon from Fox 9.
Here I am. I know on Thursday or Friday, MDH sent out letters to hospitals and clinics about how much vaccine they had on hand, how much they had distributed. Was this to work around some of the time lag issues you'd experienced, but maybe you can clarify what exactly you were seeking from hospitals and why?
Yes, I mean, you said, who did you say sent the letter out?
My understanding is MDH, and I believe you referred to this survey just a couple of minutes ago. The survey of partners.
Yep. No, thank you. I'm sorry. I misheard you and thought you said FDA, and so I was misunderstanding. Yes, we did send a survey out to our hospital partners, and the intent was to get more rapid, granular data of what was happening on the ground, so that we could address issues of fully utilizing the vaccine that we do have available to us. So we were wanting to get a sense of where they were at, if we could identify any gaps in reporting, that type of thing. So that was the point of the survey.
And did you glean any information in terms of time lags or utilization or any things to improve based on that survey?
Well, as I mentioned, when we did look at our reported data, we see that, definitely the administration dates fall on weekdays. And so that's something that, we will encourage our partners to consider, is to utilize 7 days a week for vaccinating. And we're still reviewing the information that we received.
All right, thank you.
Operator, we have time for one more question.
Your last question comes from the line of Ms. Jessica Miles from KSTP.
Hi there, thank you. Couple of questions about the variant. So 5 residents in 4 metro counties. Can you let me know the counties, and are any of these individuals related as far as family or younger folks? Also, with this variant, we're seeing this one out of the UK. I know, Sarah, you had mentioned one out of South Africa. Is this an indication that we could likely be seeing these? And, you know, down the line, is COVID something that we, like the flu shot, we may be getting a COVID vaccination for on an annual basis?
I can certainly start to say that just to comment on the vaccine issue, at this point, we don't know the duration of protection for the COVID vaccine, and so we will be continuing to monitor that. So it may be that it's necessary to receive an annual vaccination because of the duration of protection, or as you hypothesized, if in fact we see variation of the virus strain circulating and that impacts the vaccine's effectiveness, then that would be another reason that vaccination would need to be more frequent, like we see with influenza. That's in part because of the duration of protection from the vaccine and because of the mutations in the virus that occur. And I'll let Sarah comment on the other issue.
Can you just repeat for me quick the outstanding questions you have?
Sure, Sarah, thank you. So 5 residents in what 4 metro counties, and are any of these individuals related?
Okay, yes. The counties are Hennepin, Dakota, and Ramsey. And actually, I do not have the last county.
I do. I will get that. They're not. So I'll get that.
Okay. We do know 2 of the cases live in the same household, but I don't have information on if they're related.
And I think, Sarah, you had mentioned earlier that we know that a couple of folks did travel, a couple of folks we don't know, and one did not. Just to repeat that. And just to underscore one other thing Sarah said earlier that is, I think, helpful for people to understand, is we are continually screening for new variants. So we've been looking all along, and we'll continue to do so. And I think just a chance to once again thank the folks who work in our state public health lab. They are just top of their game, and we're really fortunate to have such high quality capacity here.
I'll just say that the counties are Carver County, Hennepin County, Dakota County, and Ramsey County. And I think it's really important to recognize that this is circulating in Minnesota. We've identified cases in 4 counties, but that does not mean that it is confined to those 4 counties at all. I think it's important for the public to recognize that, we've been looking for this, and so we know it's circulating in multiple places. The fact that we're finding it back from cases with onsets in December means that this is circulating in our state. So I think it's important that people are aware of it and that the importance of following our mitigation guidelines, masking, socially distancing, avoiding large groups. But I think we also want to make sure that we don't describe it as something that's unique and only occurred in 4 locations. We expect that it's circulating much more broadly.
Thanks.
Right, that is
all. Just Mike, just one further comment, and then we have to run. I know, but I think the governor had mentioned this last week that we do expect, just as we've seen the patterns of this virus around the country, that we do expect to see cases go back up in Minnesota following the year-end holidays, and potentially just as a result of the winter wearing on and more indoor time and more gatherings. And he also flagged that if this new variant is circulating or becomes a dominant strain, as we now know it is circulating in Minnesota, that also is likely to put upward pressure on the trajectory of our case growth. So again, just one more underscoring of the critical importance of continuing those good prevention practices to keep this from undoing all the progress that we've been making in more recent weeks. So thank you.
Yes, thank you, Commissioner. That is all the time we have for today's call. If any reporters have additional questions, please feel free to reach out to our office this afternoon. Have a good day, and we'll be back with you again soon.
You've been listening to State Health Leaders give the latest on